Today's theme is temporal bone, or in Latin, os temporale. Os temporale. You can see here several bony specimens, one of them colorized, and temporal bone is colorized here with violet color. Here it is. But sure, we should distinguish it on such kind specimen where bones are not colorized. So temporal bone is here. This is outer surface and this is internal surface. You can see that it isn't easy to distinguish the border between temporal bone and another bones. So, for help us in this aim, we also have such kind of specimen where sutures, the borders between bones, are colorized with yellow color. Here it is. So this is also temporal bone from internal side of the skull. And now we shall compare these two large specimens of the skull with single bones. This is right temporal bone. I can arrange it according to the skull this way. This way. And this is left temporal bone. I can arrange it according to the skull this way. And I hope you can see the main parts of temporal bone. Let's try to find them. First of all, I turn the skull with the lateral aspect and we shall compare these two specimens. So what can we find? And now I turn from another side and try to compare with this specimen. So there are several parts in each temporal bone, exactly 3 or 4 parts. Let's begin from this part. What is this? This is pars squamosa or squama. Here it is on this specimen, pars squamosa. I shall write down this term. Pars squamosa. Be attentive with pronunciation. Squama, squamosa. Pars squamosa. Here it is, this part. It is part of those parts of cavity for the brain which detect brain from the injury. So, pars squamosa is lateral part of the neurocranium, and it connects with os sphenoidali of yellow color anteriorly and os parietali of dark yellow color posteriorly and superiorly. So, pars squamosa is connected by sutures with os sphenoidali and os parietali. The second part, by the mean, pars squamosa here, this is pars squamosa. Где Гордова? Что она там делает? Гордова что делает? Она в пятом. А так слышно здесь. And second part is around this foramen. This foramen called meatus acousticus externus. And we have also this model from plastic. You can distinguish that auricula is connected with temporal bone, and this foramen, meatus acousticus externus, is part of external ear. So it has 1/3 part from soft tissues, cartilaginous tissue, and 2/3 part from bone tissue. So this is meatus acousticus externus, and for us it's interesting, what does it called, this part around this porus acousticus externus or meatus acousticus externus? What is it? It's second part of temporal bone, which named pars tympanica. Pars tympanica. Pars tympanica. Pars tympanica. So here it is. Ближе, крупнее. Here it is, pars tympanica. So this is second part of temporal bone. Pars squamosa, first part, pars tympanica, second part. Here pars tympanica is also around this foramen. So here it is, pars tympanica, around of porus acousticus externus or meatus acousticus externus. And third part is inside of the skull. Here it is. It's very hard part of the bone, so hard as stone. Stone in Latin means Petrus. So this, by the mean, very popular in Europe name Petrus means stone. And that's why this part of the bone called pars petrosa, pars petrosa. Pars petrosa, that means stone hard part. Pars petrosa. These pars also have another name according to their shape. Shape is Pyramus-like shape, and that's why also they call this part as Pyramus, Pyramus, according to shape. Pars petrosa, in parenthesis, Pyramus. Pars petrosa, seu Pyramus. So, we have found three main parts of the temporal bone. Pars squamosa, pars tympanica, and internally pars petrosa or Pyramus. Before I said that there are 3 or 4 parts in temporal bone. What does it mean? 3 or 4? We already called 3 parts, but nevertheless, we can demonstrate also this special process which named processus mastoidus. Processus mastoidus. And this process, processus mastoidus, in some classification is regarded as separate part of the bone. So we can also say that there is 4th part, processus mastoidus. But according another classification, processus mastoidus is a part of pars squamosa. So processus mastoidus, processus mastoidus. Processus mastoidus. Mastoideus, processus mastoidus. So, to summarize, temporal bone is centrally located bone in the neurocranium, and it is divided into 3 or 4 parts. Pars squamosa, processus mastoidus, they are to be regarded as common part, processus mastoidus and pars squamosa. Then pars tympanica, here it is, pars tympanica. And then pars petrosa inside, pars petrosa, and another name of this pars is Pyramus, according to their shape. Pyramus. And now let us try to study each of these parts separately. Let's begin from the squama. Squama temporale is a flattened bone which connects by the sutures with adjacent bones, exactly this yellow sphenoid bone and this dark yellow parietal bone. From squama temporale originates two processes. This process, called processus zygomaticus, and all these arcus named arcus zygomaticus. This bone, this blue bone, is zygomatic bone, and you can palpate it in your face. Zygomatic bone. And this is processus zygomaticus ossis temporale. And you can see that processus zygomaticus is connected by the suture with zygomatic bone. So, processus zygomaticus. Processus zygomaticus. Here it is. And now I shall use another specimen. Here it is. Processus zygomaticus. Number 6, processus zygomaticus. And can you explain me what is number 4? Sure, it's squama temporale. And now I shall use another single bone. This is processus zygomaticus, but it's broken. It's destroyed partially, and that's why it's shortened here in comparison with another two skull which we have seen before. And I use another bone. Here it is. Processus zygomaticus is destroyed totally, so we can find only the place where it originates, but the process itself is destroyed here. And second process, which we can say also is part of squama temporale, is this. What is this? It's mastoid process. Mastoid process. Processus mastoidus. Processus mastoidus. Again, processus mastoideus. Processus mastoideus, it's interesting that newborn child does not have processus mastoidus. Why? Because do you know that newborn child can't hold his head. When mother carry newborn child on her hand, she ought to help that head of the child will be horizontally or vertically. So newborn child himself can't hold his head because the muscles are not strong. In intrauterine period, he was developed inside of water. And that's why there were not difficulty for him to hold a head in water environment. But in air environment with gravity, earth gravity, it's quite difficult. And for newborn child, about 3 weeks is necessary to strengthen his muscles, which can hold the head. And usually after 2 months after birth, a newborn child can hold the head himself because the muscles were strengthened. And it's interesting that these muscles which held the head of child, they attached to this place. So when they strengthen, they tied this part of the bone and it becomes as elongated process. Before it was absent, and during these everyday exercises with strengthening of muscles, this process appears. So processus mastoidus, and we should know just now that one of the most important muscles which held the head is musculus sternocleidomastoidus. Sternocleidomastoidus. I shall write it down in parentheses. Musculus. Usually we use this abbreviation for musculus, M with point. Musculus sternocleidomastoideus. It's possible to write down without defice, but I use these defices for you can distinguish that 3 parts of bones are connected by this muscle, sternocleidomastoidus, and mastoidus means this process. Exactly here, musculus sternocleidomastoidus attaches for moving the head. So, if we turn processus mastoidus by inferior surface superiorly, we can find here two grooves, one and another, one and another, one and another. What they are. This one and this one. What they are. One of them named incisura digastrica. Incisura digastrica, because this special, this location is location of attachment of musculus digastricus. So, incisura digastrica. Incisura digastrica, because it is place of attachment of musculus digastricus, musculus digastricus, which helps to move the mandible. Incisura digastrica. Here it is. Incisura digastrica. And close to it, near to it, we can find a special sulcus for arteria accipitalis. Here, very interesting arteria passes, and in this point, if you try just now, palpate it in your head, you can find a beat of pulse, because arteria occipitalis appears under the skin in this point. So this sulcus named sulcus arteriae accipitalis. Sulcus arteriae, excuse me, sulcus arteriae. Why? Здесь два языка, да? Почему-то нет. Sulcus arteriae occipitalis. Sulcus arteriae occipitalis. So here it is. Sulcus arteriae occipitalis. Sulcus arteriae occipitalis. So these structures we have found posteriorly. And now I'd like to demonstrate to you here fossa mandibularis, a special place for forming a joint, temporomandibular joint. So this is fossa mandibularis, fossa mandibularis. Fossa mandibularis. I shall write it down. Fossa mandibularis. For temporo mandibular joint. This is articular cavity for articular fossa for temporomandibular mandibular temporomandibular joint, temporomandibular joint. So again, fossa mandibularis. Here it is, fossa mandibularis. Let me demonstrate it to you in another specimen. Here it is. And here it is. If you are quite attentive, you can find that inside of this fossa there is a special sulcus which divides between each other two parts of the bone. So this sulcus names or calls sulcus tympano-squamosa. So this is pars squamosa, this is pars tympanica, and so this is sulcus tympano-squamosa. Sulcus tympano-squamosa. And here, sulcus tympano-squamosa. Sulcus tympano-squamosa. I shall write it down. Sulcus tympano-squamosa. Dear colleagues, sure, each term which is written down just now on our screen, you should know, you should demonstrate on the specimen, and you should write down by the heart. So in Latin, these terms you are necessary to know. So, sulcus tympano-squamosa. This is a border between two parts, between pars squamosa and pars tympanica of the temporal bone. Okay, and now let's turn the specimen to the internal cerebral surface. Let's change the specimen. I shall use this one. And if you will be quite attentive, you can find that here there are some grooves and sulci and crests. All of them looks like footprints of the fingers. So that's why they called as impressiones digitate. Impressiones digitate. What does it mean? Footprints of the finger. But really, you understand that no one made special footprints by fingers here. But why these impressions appeared? Because the surface of the brain has a lot of gyri and sulci. And that's why when the skull were ossificated, all this relief of the brain was footprinted on the internal surface of the bones. So, impressiones digitate are the footprints of the gyri of the brain. It's very interesting. Interesting because skull in adult person is hard and brain in adult person is soft. But nevertheless, during development, this soft brain made footprints on the yet not ossificated bones for the whole life. So, impressiones digitate. And also, let me turn the specimens this way. You can see that it is colorized special vessels, arterial vessels, which take place here. So these are sulci arteriose, sulci arteriose. Several special vessels, arterial vessels, have the footprints also on the internal surface of the temporal bone. So, sulci arteriosi, sulci arteriosi, sulci arteriosi. Here they are. Okay, we have finished with you the studying of squama temporale. And now, let us begin study the tympanic part. Pars tympanica, again pars tympanica, second part of the temporal bone. So, first of all, there is very interesting structure here, which is small but quite prominent. It is placed above this foramen. You remember that this foramen named porus acousticus externus. Porus acousticus externus. I shall write it down. Porus acousticus externus. Porus, oh, I miss one letter. Porus acousticus externus. Porus is this foramen, but canal is inside of it, named as meatus acousticus externus. Meatus, like canalis, canal. Meatus acousticus externus. Meatus acousticus externus. Porus acousticus externus and meatus acousticus externus. And above we can find this small but very sharp and prominent structure which called spina suprameata. Spina suprameata. Spina suprameata. Spina suprameata. This spina suprameata is one of the point which is clinically have serious significance because of necessity to surgical opening of this place. In which situation it's necessary? Sometimes inside of processus mastoidus, there is inflammation, and in serious disease, it's necessary to evacuate pus from the internal cellula of this process. Inside of it, there is an air which fulfill the small cellula. And if inflammation takes place, so it's necessary to evacuate pus from the internal cavity of this process. So they made artificial opening, orifice, and this allows to pus be evacuated. So spina suprameata is important surgical point. And we should demonstrate here two borders for pars tympanica. One of them we already have called, this is sulcus tympanosquamosa. Sulcus tympanosquamosa. We already know it. Sulcus tympanosquamosa. It is the border of pars tympanica anteriorly. But what is this? This is the border of pars tympanica posteriorly, and this sulcus named as sulcus tympanomastoide. This is sulcus tympanomastoide. I shall write it down. Sulcus tympanomastoide. Sulcus tympanomastoide. Here it is. Sulcus tympanomastoidea. Sulcus tympanomastoide. Tympanomastoide. Sulcus tympanomastoide. So now we know two borders of pars tympanica, sulcus tympanomastoide and sulcus tympanosquamosa. It's interesting that close to these structures we can find two very interesting another structures. This one is processus styloidus, number 6. It's designated as number 6 in this specimen. Processus styloidus, like stylus or stillet, special knife with slender and long blade. So, processus styloidus. Processus styloidus. Processus styloidus. Here it is. Processus styloidus. Very often it could be destroyed on the specimen because it is very, how to say, it is very destroyable because of its slender and it's easy to damage it. And between this processus styloidus and processus mastoidus, if we make this way, we can find a special foramen stylomastoidum. Foramen stylomastoidum. Foramen stylomastoidum. I shall write it down. Foramen stylomastoideum. Foramen stylomastoideum. Here it is. Foramen stylomastoideo. Very important orifice through which some nerves passes. Nerves pass. For example, nervus facialis, seventh cranial nerve, foramen stylomastoideo. So now we know about the pars tympanica, and let's try to study pars petrosa. Pars petrosa or Pyramus чуть дальше. It is three quaterum Pyramus with apex oriented medially and anteriorly. Чуть дальше. We can compare the single bone with the skull. So apex, here it is, apex, and basis, which is connected with squama temporale. So this is Pyramus. This is basis of Pyramus. This is apex. And Pyramus or pars petrosa has three planes, three surfaces. First of them is there. Here it is. It's oriented, if we make in right position our skull this way, so this surface will call the anterior surface of Pyramus. Anterior surface, it's mean facies anterior Pyramus. Facies anterior Pyramus. Facies anterior Pyramus. And another surface is oriented posteriorly, so it's called as facies posterior Pyramus. So we can find facies anterior Pyramus and facies posterior Pyramus. And now I use single bone. So this is facies anterior Pyramus and this is facies posterior Pyramus. And between them we can find a special sulcus which is colorized here with blue color. Why? Because here is a special vessel, venous vessel, but it's special, so it doesn't name as vein, but sinus petrosus superior. So this is sulcus sinus petrosus superior. So let me put you a question. What is the border between facies anterior pyramis and facies posterior pyramis? The right answer should be, it is sulcus petrosus superior. Let me write it down. Sulcus petrosus superior as a border, between them. Sulcus petrosus superior as a border, or is a border between them. Is a border between these two surfaces. But we have said that there are three surfaces of the pyramis, but we have found only two. But where is the third? To find the third surface, we should turn the skull by the external position. This is anterior surface, this is posterior surface, facies anterior, facies posterior, and now I shall turn the skull and we have find this inferior surface. And third surface is facies inferior. This is facies inferior. Facies anterior pyramis, facies posterior pyramis, and facies inferior pyramis. Please remember that to demonstrate facies inferior, it's necessary to turn the specimen. And now let's try to demonstrate all these three surfaces of pyramis on single bone. Facies anterior, facies posterior, and now I turn facies inferior. Between of the facies posterior and facies inferior, we again can find a border. This border is good seen here as sulcus petrosus inferior. It's colorized here with blue color because it's again a special sinus, a special blood vessel, which is the border between facies posterior and facies inferior. Sulcus petrosus inferior is a border. Sulcus petrosus inferior is a border. So now we can be oriented in pars petrosa. So now let's find special landmarks in each of three these surfaces. Now the next task for us. Facies anterior pyramis. What should we demonstrate here? First of all, we should know this structure. This. What is this? It's impressio nervi trigemini. Impressio nervi trigemini. Impressio nervi trigemini. Impressio nervi trigemini. Where is located? In the apex of Pyramus. Impressio nervi trigemini. On the apex. On the apex. This is an apex, and here on anterior surface we can find impressio nervi trigemini. Next very important structure is surnamed tegmen tympani. This part, tegmen tympani. Tegmen tympani. Tegmen tympani. It means roof of tympanic cavity. Tegmen tympani. Tegmen tympani. Tegmen tympani. So, impressio nervi trigemini and tegmen tympani. And then we should find two very small sulci and orifices. They're here. You can see that they're very narrow, very small, very tender. But we should know them. Sulcus nervi petrosi. This abbreviation N with point means nervi, nervus. Sulcus nervi petrosi majoris and minoris. Sulcus nervi petrosi majoris and minoris. They are so small and so close to each other take place that usually we can't distinguish where is sulcus sinus nervi petrosi majoris and where is minoris. But we should know that laterally is sulcus sinus nervi petrosi minoris, and medially is sulcus sinus nervi petrosi majoris. So here they are. And they are finishing with this very small orifice. What is this? What is this small foramen? It's named as hiatus. Canalis nervi petrosi majoris and minoris again. Majoris et minoris. Majoris majoris minoris. So we should know with you on the anterior surface these four structures, which is written in our screen. So impressio nervi trigemini, this one, which is located on the apex of Pyramus. Tegmen tympani, this place, about 1 centimeter of diameter. Then two sulci, which usually are located together, sulcus nervi petrosi majoris and minoris. Here they are. And they enter, number 4, the hiatus canalis nervi petrosi majoris and minoris, this small orifice. Hiatus canalis nervi petrosi majoris and minoris. So we should know by the heart these four structures on the anterior surface of the pars petrosa. And now let's study the posterior surface of pars petrosa. Posterior surface of pars petrosa. Posterior surface. Чуть дальше. Чуть ближе. Хорошо. So. Facies posterior pyramis. Facies posterior pyramis. What should we know here? First of all, this orifice. What is this? Number 67 in this specimen. What is this? It's porus acousticus internus. Porus acousticus internus. Here, two nerves pass through. Seventh cranial nerve, nervus facialis, and eighth cranial nerve, nervus vestibulocochlearis. So, porus acousticus internus. Porus acousticus internus. So, nervi. These two letters N with point means nervi in plural. Nervi. Seventh and eighth pass through it. Then, very important and very small impression. Here it is. So named apertura externa aqueductus vestibuli. Apertura externa aqueductus vestibuli. Apertura externa aqueductus vestibuli. I shall write down. Apertura externa aqueductus vestibuli. Apertura externa aqueductus vestibuli. So, this is, excuse me, this is small structure. Apertura externa aqueductus vestibuli. And let us call this large sulcus. What is it? Sulcus sinus sigmoidus. Sulcus sinus sigmoidus. Here it is. Sulcus sinus sigmoidus. Sulcus sinus sigmoidus. Exactly speaking, it isn't quite correct. They are located close to each other, number 2 and number 3, about 1 centimeter between them. But number 3 is sulcus sinus sigmoidus. Really, it's internal part of pars petrosa, of pars squamosa. But because they are located close to each other, we shall write down them as parts of posterior surface of Pyramus. Okay. And now let us study third part of pars petrosa, inferior surface. Here it is, inferior surface. Facies inferior Pyramus. First of all, we should like to demonstrate this foramen. Foramen caroticum externum. As beginning, originating of canalis caroticus. Through it, a special artery which supplies the brain enters the cerebral cavity. So, foramen caroticum externum. Foramen caroticum externum. It means that it leads to canalis caroticus. Canalis caroticus. Canalis caroticus, which is for arteria carotica, the main artery for supplying blood supply of the cerebrum. So, foramen caroticum externum. Close to it, we can find here, if I use the skull, we can find here foramen jugulare. Foramen jugulare. Foramen jugulare. But if we use a single bone, we can find not foramen jugulare, but only incisura jugulare. Incisura jugulare with fossa jugulare. Here it is, fossa jugulare. Fossa jugulare. Fossa jugulare. Foramen caroticum externum, number one. And number two, fossa jugulare. Fossa jugulare. So, here it is, fossa jugulare. And here, foramen jugulare. Fossa jugulare and foramen jugulare. And very interesting and, important small structure which called apertura externa canaliculi cochlea. Apertura externa canaliculi cochlea. Here, a special canal of internal ear take place. apertura externa, canaliculi cochlea. Apertura externa, canaliculi cochlea. Here it is. And last small structure is very narrow, very small, very thin, but has very long designation. So this is fossula pitrosa. Fossula pitrosa. Fossula pitrosa. Number 3. Fossula pitrosa. Fossolate means extremely small foss. Fossula pitrosa. How can we find it? It's located between two structures, between fossa jugularis and foramen caroticum externum. So to find it, we shall know these two adjacent structures, fossa jugularis and foramen caroticum externum. So here it is, fossula pitrosa. Between fossa jugularis and foramen caroticum externum. Foramen caroticum externum. Now, it isn't enough space for this term. So, fossula pitrosa. You shall remember that to find it, we shall first of all find fossa jugularis, then foramen caroticum externum, and between them we shall find fossula pitrosa. And now here, fossa jugularis, foramen caroticum externum, and fossula pitrosa. So, all these structures are structures of inferior surface of Pyramus. And now, several words, about canals of temporal bone. Canals of temporal bone. Canals. Canals. We should to know 3 large canals. First of all, we already said Canalis caroticus. Canalis caroticus. Canalis caroticus. I'd like to demonstrate on this skull that my pointer begins here in foramen caroticum externum, and then we can find it internally here. So this is canalis caroticus. Canalis caroticus. Canalis caroticus. Sure, it's necessary for carotid artery, which supplies the brain with arterial blood. Then, number 2, canalis nervi facialis. Canalis nervi facialis. It originates from the porus acousticus internus and finishing here in foramen stylomastoidum. Porus acousticus internus, foramen stylomastoidus. It travels inside of cavum tympani. So from porus acousticus internus to the foramen stylomastoidum. From porus acousticus internus to foramen stylomastoidum. From porus acousticus internus to foramen stylomastoidum. In another specimen, porus acousticus internus. And to demonstrate foramen stylomastoidus, we shall turn the specimen. Here it is. Foramen stylomastoidus. And then number 3, canalis musculotubarius. Musculotubarius. Canalis musculotubarius. To find it, we shall use the single bone, not the skull, to turn by the apex to our face, and here we shall find canalis musculotubarius. Canalis musculotubarius. This name, musculotubarius, because it is subdivided into 2 small canals, semicanalis. one half of the canal, semicanalis tube auditive and semicanalis musculus tensor tympani. So that's why canalis musculotubarius very important. It enters to the middle ear from the not nasal cavity but pharyngeal cavity. It's interesting that when we are flying on the plane, during the takeoff, we usually feel something strange in our ears. Why? Because the pressure, the air pressure, atmospheric pressure between our environment and middle ear is connected through this canal. And that's why we can feel some strange feelings. So, 3 large canal. And also we should know 2 small canaliculi. In this screen, it's written canales, canals. We should know 3 canals, but also we should know 3 very small, very thin, but very important canaliculi, very small canals. So, now I shall canali. Canaliculi. They are, first of them is Canaliculus horde tympani. Canaliculus horde tympani. Canaliculus horde tympani. Canaliculus horde tympani. For very small but important nerve inside of temporal bone, through which we can feel the taste. Canaliculus horde tympani. It begins it originates inside of the foramen stylomastoidus and finishing in fissura petrotympanica here, fissura petrotympanica. So, foramen stylomastoideum to fissura pietrotimpanica. To fissura pietrotimpanica. Canaliculus horda tympani, which extends from foramen styloum osteidum to fissura pietrotimpanica. Here it is. And second small canaliculus. Canaliculus tympanicus. Which originates here, what is it? Fossula pitrosa, and finishing here, hiatus canalis nervi pitrosi minoris. Hiatus canalis nervi pitrosi minoris. From fossula pietrosa to hiatus canalis nervi pietrosi minoris. Hiatus canalis nervi pietrosi minoris. In our screen, the last word nervi pietrosi minoris does not have place. So, canaliculus tympanicus originates from fossula pietrosa and is finishing in hiatus canalis nervi pietrosi minoris. This last word, please write down. So, we should know 3 canals and 2 small canaliculi. So, we are finished. It's okay. But before to make the point, we shall begin one another small but important bone. Os ethmoidale. Os ethmoidale. Os ethmoidale is one of the bones of neurocranium. It has a central position between 2 orbital parts of frontal bones, so it's dark violet here, and we can find it also inside of the nasal cavity. Inside of the nasal cavity. So, os ethmoidale. First of all, I'd like to demonstrate you lamina cribrosa. So, name is due to numerous small foraminae through which olfactory nerves pass through. Lamina cribrosa. In central part of it, we can find this crest, Crista galli, the crest of the cock, Crista galli. And also, before it, we can find a small foramen, which named foramen secum, blind foramen secum, foramen, so. Foramen secum, blind foramen. And also we can find the lamina perpendicularis, lamina perpendicularis, which is the border between two symmetrical parts of the nasal cavity, left and right. Lamina perpendicularis. And also, lamina perpendicularis. And also, there are two very important structures inside of nasal cavity. This specimen was before cutted in sagittal plane, and we can find here so named concha nasalis media and concha nasalis superior. Concha nasalis media and concha nasalis superior. Concha nasalis media et superior. So this is concha nasalis superior, and this is concha nasalis media. How shall we demonstrate these concha if skull isn't cutted? So we can find here concha nasalis media and close to it concha nasalis superior. To demonstrate it, we should turn the skull by the basis, for we can see these foramina which named cone which called Juani. This is left Juan and this is right Juan. Through Juans, we should find concha nasalis media and superior. And also, we can't see here without any cutting, but we should know that inside of it there are air containing numerous cellula ethmoidalis. Cellula ethmoidalis. Cellulae ethmoidalis, air containing small cavities which are inside of the ethmoid bone. So, cellulae ethmoidalis are inside, and just now we can't see because it's necessary to remove these conchae. But during each breath in, the air fulfill these cellulae, and this is one of the means for warming the air in situation, for example, of cold winter, when we breathe in through the nasal cavity, through the nose. So, dear colleagues, what are the summary of this lecture? You should know each of these terms, its first, and the second, you should demonstrate it on the bones, on the specimen, and